ভিডিওটি জুনিয়র হোমিওপ্যাথিক চিকিৎসক বন্ধুদের দেখানোর জন্য এবং শেখানোর জন্য। ল্যাটারাল স্ক্লেরোসিস অ্যানাটমি ফিজিওলজি না জানলে এই সমস্ত জিনিস বোঝা একটু প্রবলেম হয়। সেগুলো কোচিং ক্লাসে আমি পড়িয়ে চলেছি, যারা জানে না তাদেরকে বোঝানোর জন্য। ল্যাটারাল স্ক্লেরোসিস causes the motor neuron paralysis, MND, motor neuron disease. So this person is suffering from motor neuron disease, both upper and lower. You know there are two types of motor neuron disease, upper motor neuron disease and lower motor neuron disease. So the symptoms of the motor neuron disease is the flaccidity of the muscles. There is lack of controlling power of the muscles. নিজের ইচ্ছা মতো আর কন্ট্রোল করতে পারে না, ল্যাক অফ এনার যেমন ফুললি ফ্লাসিড প্যারালাইজড কন্ডিশন হয়নি, হাফ প্যারালাইজড হাফ ফ্লাসিড. সো মোটর নিউরন ডিজিজ ইজ স্লোলি গ্র্যাজুয়ালি অ্যান্ড ইনসিডিয়াসলি অ্যাডভান্সিং. So this patient has developed left-sided hemiplegia. Now in homeopathy, 1,000 times I am repeatedly telling you that motor neuron disease or any other disease is the result of derangement of the vital force. We do believe that derangement of the vital force cause physical ailments. So the treatment should be done to the patient as a whole in the integrated way, in the totality way. The totality of the patient corresponds to the symptom of the causticum, that means Hahnemann's tincture or sine carry, the medicines which is prepared from the hydrate of potash. And it is a wonderful medicine for all kinds of paralysis, followed by cerebrovascular accident or due to motor neuron disease. But always symptoms, some symptoms you should require, you should feel, you should observe, you should find out, you should search some symptoms, otherwise there is every possibility of failure. Symptoms. Along with the symptoms, the fears of action, special affinity to the medicine is to be looked at. In causticum, there are some symptoms of this patient as corresponding. The patient is chilly, sheath beshi. The patient is anxious, anxiety, sympathetic. There are many moles and warts here and there, especially right side of the body. There are many moles and warts here and there. And along with that, I have told you the fears of action is very, very important. If we go through the causticums, fears of actions disturb functional activity of the brain and spinal cord. Disturb functional activity of the brain and spinal cord from exhausting diseases or severe mental shock resulting in paralysis. তাহলে ম্যাথমেটিকা পড়ার সময় while studying the mathematica or going through the chapters of the mathematica, you should look after every point and carefully it should be analyzed. What is written here? Even after severe mental shock. Does the allopathic physician believe this theory? Disturbed functional activity of the brain and spinal cord due to severe mental shock? No, they do not believe. They have no idea about this. They are always busy with the crude pathology, with the crude symptoms. স্থূল জগৎ নিয়ে পড়ে থাকে। বারবারই বলেছি, মানুষের অন্তরের ব্যাপার, অন্দরের ব্যাপার, মনের ব্যাপার তারা জানে না। But many diseases are being escaped from the mental side, mental origin. So it is causticum to অ্যালেন স্কিনারটা অনেকেই পড়েছে বারবার। অনেকে কি এই লাইনটি খেয়াল করেছো? Disturbed functional activity of the brain and spinal cord from exhausting disease or severe mental shock. And that's why psychosomatic treatment is essential and indispensable for homeopathic physicians. So this patient requires causticum, and causticum is given in the 50 millisimal scale of potency once daily in the morning, starting from 0 by 1, 2, 3, 4, etc. Let's see the result. I shall show you, my friends. একটু হেঁটে দেখাও তো কিরকম হাঁটতে পারো। বসো।